Good morning, everyone. My name is Robert Hersey. Happy Wednesday to each of you. And on behalf of FATA, welcome to today's webinar titled Florida Substance Use Trends Annual Report 2025. This webinar is being made available through a collaboration between the Florida Department of Children and Families and FATA. Please note that as an attendee, you are in listen-only mode and are only able to see your name. Your webcam and microphone have been disabled. If you have questions, please send them using the chat panel. We will answer questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the audio connection panel. For computer audio, click the up arrow next to unmute, then click the switch audio connection panel. Click disconnect, click the up arrow and switch audio connection buttons again, then click call in using computer and follow the instructions. If you continue to experience poor audio through your computer, try using the I will call in option. The event, password, and access code will be posted in the chat panel momentarily. Please note you must be connected to the audio of this presentation as well as view it on screen to receive a statement of credit. We are unable to verify attendance if you are not connected to WebEx via your computer or the WebEx mobile app. Therefore, phone call only attendees are not eligible for a statement of credit or CEUs. The recording and materials used in today's webinar will be available on the FATA website within 30 business days. To access the recording and PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credit earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through FATA. A statement of credit and CEUs for up to 2 continuing education credits are available for participating in today's webinar. CEUs are available for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. Completing the post-webinar evaluation is necessary to receive CEUs or to access your statement of credit. Please note that the evaluation will close at the end of the day on Monday, June 30th, 2025. At the end of today's webinar, you will have 3 opportunities to complete this evaluation: a link posted in the chat panel, a follow-up email from WebEx, and an automatic web browser pop-up when I end the webinar. To complete the evaluation, you will first need to register or sign in to your FATA account. Please ensure your name and email address match the name and email you use to register with WebEx. Information you provide FATA as part of registering remains confidential. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified by the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your license or certification number when you register with our site. If you need assistance with account registration, logging in, or accessing the evaluation, you can fill out a contact form on our website or email training@floridabha.org before June 30th, 2025. Please note that WebEx monitors the arrival and departure times of attendees and provides a report upon completion of the event. We are not permitted to provide a statement of credit if you do not attend the entire webinar, and we are not permitted to provide partial CEUs. Statements of credit and CEUs will be posted within 30 business days after the evaluation closes. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenter and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, FATA, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Our presenter today will be Ben Hackworth. Ben has over 5 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentations. Ben previously contracted with the Center for Substance Abuse Research as a Sentinel Site epidemiologist for the National Drug Early Warning System, funded by the National Institute on Drug Abuse. Ben graduated with a Master of Public Health from the Northwest Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. His specialization is in health promotion and education. And now I would like to turn it over to our presenter, Ben Hackworth. Ben, I will turn it over to you.
Thank you, Robert, and welcome everyone. Good morning, and I'm excited to go over a lot of data that we have for you today through this annual report, and we can go to the next slide. So the objectives for this webinar are as follows. To identify trends among the various substances we'll be discussing today and understanding the patterns of substance use regionally and statewide. Lastly, identify substance use trends for fatal and non-fatal overdoses in Florida. Next slide. So the 2025 annual report on substance use trends in Florida offers new Florida data trends available in the 2025 annual report. This is an update from the annual report update from 2024, and it primarily uses information about Florida and its focus on youth trends and substance misuse in Florida as well. We'll also be providing an update on substance-related deaths from the Florida Medical Examiner's 2023 annual report as well. Next slide. So I gathered a lot of data sources from a lot of different secondary data that I collect and analyze and is reported in this annual report. And for this most recent report, we have data from the Centers for Disease Control and Prevention. We have Florida health charts provided by the Florida Department of Health. We'll use mortality data from the Florida Medical Examiners Commission and also the Florida Youth Substance Abuse Survey as well. We can go to the next slide. So for the methodology used throughout this report, the Florida Youth Substance Abuse Survey assesses risk and protective factors for substance use and is administered in Florida's middle and high school students. So we'll see a lot of data from that survey. And we'll also be using a lot of data on substance use among adults and youth in the United States and Florida from the National Survey on Drug Use and Health. This is sponsored by the Substance Abuse and Mental Health Service Administration, or SAMHSA. And this source provides prevalence rates for substance use based on survey responses. On the next slide. To continue on with our methodology throughout this report, for morbidity, we use hospitalization and emergency department data from Florida health charts. And also we will be using mortality data from the Florida Medical Examiners Commission with their annual report for 2023. We'll go to the next slide. So when we get towards the end of the presentation, we'll be going over um, data by managing entity. So I just want to go over the different managing entities that we have through DCS or DCF. So the Florida Department of Children and Families, DCF contracts with 7 regional systems of care, known as managing entities, to provide behavioral health services to people throughout the state. Because Florida is such a large state and diverse, this model shows that each managing entity will respond to specific behavioral health needs of its region. Um, with the exception of one, each region is comprised of a group of geographically contiguous counties. So just to quickly go over the managing entities, um, since we'll go over this later in the presentation. The first managing entity we can go over is the Northwest Florida Health Network in blue, and it serves the smallest population with 1.6 million people, or about 7% of the state's population. Lutheran Services Florida makes up the Northeast and part of Central Florida in yellow. And that's almost 20% of the state's population. And then there's Florida, or Central Florida Behavioral Health Network. This serves the largest population with 6.4 million people. And this is about 28% of Florida's population. Then we can move over to the Central Florida Cares in orange, serving 13% of the state's population. There's Southeast Florida Behavioral Health Network, serving 10% of the population, and those counties are shaded in pink. And then we have Broward Behavioral Health Coalition, serving just Broward County. And then lastly, Thriving Mind South Florida only serves 2 counties, but makes up 13% of the state's population. We can go to the next slide. Okay, so to get into the straight into the data, this comes from the National Survey on Drug Use. This is self-reported pain reliever use among adults in the past year. So US data points are shown in blue, and Florida data points are shown in orange. And overall, we can see a downward trend line for pain reliever misuse among both adults in Florida and the US. For the 2021 to 2022 survey results, US adults remained at the same rate of use from the previous survey year at 3.2%, and Florida adults slightly increased to 3%. For the most recent survey, which is the 2-year average for 2022 to 2023 survey results, the US had a 0.1 decrease, and Florida saw another increase in use at 3%. So with this data, we see somewhat of a stable trend in the past couple of survey years, and we can compare this to the past 2 survey years as well. So this is a good indicator that we're having a steady rate of use for pain reliever use among US and Florida adults. We can go to the next slide. For youth, we see a similar decline in rates for pain reliever misuse up until the 2021 survey results. And this is where survey results plateaued for both US and Florida youth. Again, the rate of use for U.S. youth remained the same for the current survey year as it did from the previous survey year, and Florida youth reported misuse at 2.1%, which was an increase from the previous year. So overall, we're seeing an increase in Florida prescription pain reliever misuse among youth and adults in the most recent surveys. Next slide. For the Florida Youth Substance Abuse Survey, we can look at this data and look at what Florida youth are, um, and look at their lifetime and past 30-day use. And so for pain reliever misuse among Florida youth from 2010 to 2024 is shown here. And there's been a sharp decline. Lifetime misuse of pain relievers has decreased by 67% from 2010 to 2024. And for past 30-day use, rates have decreased by almost 69% from the same time frame. Overall, youth in Florida have reported the lowest rates of misuse of pain relievers in 2024. As you can see here, past 30-day use falls below 1%. Next slide. So another survey results that we can look at is the Monitoring the Future survey, specifically for prescription pain reliever misuse. They only ask seniors across the U.S. Um, about their misuse, and this graph shows 30-day and lifetime misuse across the years from 2015 to 2024. And as you can see here, we're seeing a decreasing trend from this time frame, just as we saw in the previous surveys. You may notice a sharp decline in 2021, and investigators and researchers that work with the Monitoring the Future survey say that COVID had a dramatic impact on our youth and their behaviors. With that, there could be a number of reasons why the dramatic decrease occurred, whether related to drug availability, family involvement, differences in peer pressure, or other factors. While the drug use decrease in the survey year is shown, um, there are also other reports why this drop could have happened as well. And we see, though, in 2022, reported use of prescription pain relievers increased. However, this is going back to another decrease in the past three survey years, as we can see here from 2022. And so in 2024, with this latest survey, we see the lowest rates for pain reliever misuse among seniors, with 1.7% using pain relievers in the past 30 days and 7.1% using pain relievers in their lifetime. You go to the next slide. So now we'll move on to heroin use. And again, this data is shown from the uh, National Survey on Drug Use. And past year heroin use among adults in the US and Florida has had a prevalence, has had different prevalence rates, increase and decrease from 2015 to 2023. However, for the last survey results for 2022 to 2023, we see 0.25% of Florida adults report using heroin, while US adults saw a decrease in use but still high uh, at 0.33. So we're, we don't have very high rates of heroin use among adults in the US and Florida, as you can see here from this slide. Go to the next slide. So now we'll look at past year heroin use among youth in the US and Florida. This is from 2015 to 2023. Prevalence rates among youth ages 12 to 17 are not available for heroin use because no respondents in this age range reported use of heroin in the past year. And so that's why you see the prevalence has been shown as 0 since pre-pandemic. So um, yeah, so there's basically no reports of heroin in the that's coming from the survey among youth in the US and Florida. Next slide. When looking at the Florida Youth Substance Abuse Survey for lifetime and pastime or past 30-day use for heroin, we'll see an overall decline in use as well since 2010. We do see a slight spike in 2020, but overall since then we've seen a decrease, and we see very low rates overall for lifetime and past 30-day use for heroin among youth. For example, past 30-day use is reported at 0.1% and lifetime use is reported at 0.3%. So very low rates of heroin use in Florida among youth and adults. Next slide. The next substance we'll discuss is cocaine. Past year cocaine use among adults in the US and Florida from 2015 to 2023 is shown here from NSDUH data. Cocaine use among adults is more common than heroin use, but less common than prescription drug use. Prevalence rates have increased among Florida adults, while rates among US adults have decreased slightly. So we see here, just comparing the 2021 to 2022 data to the 2022 to 2023 data, we see the increase from 1.5% to 1.98% for Florida adults endorsing cocaine use. And then we see the decrease from 2% to 1.6% for US adults. So they saw a decrease. We'll go to the next slide. Looking at past year cocaine use among youth in the US and Florida is shown here from the same survey. Cocaine use among Florida and US youth has increased again in the most previous survey. In 2021 to 2022, both the US and Florida had a 0.14% prevalence rate for cocaine use. Florida increased its rate to 0.18%, and the US increased its rate to 0.2%. So a slight increase in cocaine use among US youth and Florida youth as well, according to the survey. Next slide. Survey results from the Florida Youth Substance Abuse Survey is shown here for lifetime and 30-day use of cocaine. This shows a more prevalent decrease among use from 2010 to 2024. Rates are very low for cocaine, with only 0.2% using in the past 30 days and 0.5% in their lifetime. So again, this is cocaine is more common than heroin, but less common than prescription drug use among youth as well in Florida. Next slide. So now we'll go into methamphetamine use and past year use for US adults in Florida from 2015 to 2023 is shown here. Methamphetamine use among US adults has increased to the highest prevalence rate of 1.03% in the most recent survey. And we see the increase in methamphetamine use start around the 2017 to 2018 survey results. For Florida, rates have also increased from 0.6% to 0.76%. So overall, we're seeing an increase for adults in Florida and the US misusing methamphetamine in the past year in the most recent survey. Go to the next slide. When we look at methamphetamine use among youth throughout the US and Florida, it's more sporadic as we see here than the previous slide. We see a drop in prevalence rates in 2021. Again, the cause of this could be because of COVID, and also this is a single year data survey. It's not the 2-year average that we normally see. And if you look at the prevalence rates, they're closer to the previous year's numbers, and especially if you look at Florida youth rates. So methamphetamine use among youth in Florida is slightly higher in the most recent survey with 0.14%. So Florida shows slightly higher rates among youth for methamphetamine use in the most recent survey. We go to the next slide. For methamphetamine use among youth in Florida for lifetime and past 30-day use, we see data from the Florida Youth Substance Abuse Survey. And past 30-day use has stayed consistent between 0.3% and 0.5%. Past 30-day prevalence use has remained the same in 2024. And lifetime use has seen a decrease since 2020. Methamphetamine use among Florida youth is 0.1% higher for both 30-day and lifetime use in 2024, according to the FYSAS. And we can go to the next slide. So now we'll move on to the next substance, which is marijuana. Past year marijuana use among adults in the US and Florida from 2015 to 2023 is shown here. And marijuana is the only substance we continuously see increases in past year and past 30-day use among adults in the US. Nationally, past year use of marijuana is at 22.9%, which is a 1% increase from the previous survey year, while 20.5% of Florida adults used marijuana in the past year. This was a 3% increase from the previous survey year. You can go to the next slide. For past month, marijuana use among adults in the US and Florida is shown here from 2015 to 2023. And again, we see pretty similar trend lines for past month use, just as we went over past year marijuana use in the previous slide. And second to only alcohol among substances covered in this report for adults, Florida has seen an increase again in the most recent survey. So 15% of adults in Florida used marijuana in the past month, while 16.1% of adults nationally reported using marijuana in the past month. Again, this is another 3% jump in use as we see for Florida adults. And overall, we're seeing continuous increases in past year and past month use among adults, both in the US and Florida. However, for both past year and past month, US adults show higher rates of use than in Florida. We can go to the next slide. So this is looking at past year marijuana use among youth in the US and Florida. And this is more interesting because we don't see similar trend lines for the US and Florida youth as shown here. Past year marijuana was on a downward trend, but we see a slight increase in the most recent survey years, with the US and Florida youth reporting 11.9% and 11.3% past year marijuana use, respectively. So we're not seeing that upward trend among youth like we are among adults, as you can see here. We can go to the next slide. So the previous looking at past month marijuana use among US youth and Florida youth as well. So there's a more steady rate for past month marijuana use up until COVID, and that's where we see a drop in rates in 2021. But again, this is a single year data versus the 2-year averages that we normally have, and also COVID, I think, affected substance use misuse as well, as we noted earlier. So after 2021, the 2021 to 2022 survey results are back to what they were pre-COVID at 6% of youth using marijuana in the past month. And then the most recent survey for 2022 to 2023 showed a decrease among US youth, but a 0.5% increase among Florida youth. We can go to the next slide. So Florida Youth Substance Abuse Survey also looks at marijuana use among lifetime and past 30-day use for Florida youth. And it slowly declined from 23% to 20% from 2010 to 2020. In the same time period, a 3% decrease was also reported for past 30-day use. However, for both lifetime and past 30-day use, rates have decreased more rapidly since 2020, with only 13.2% reporting lifetime use in 2024 and 6.3% reporting for past 30-day use. So these are some of the lowest rates that we've seen in the most recent survey. Next slide. Um, for lifetime marijuana use among 8th, 10th, and 12th graders across the US is shown here from the Monitoring the Future survey. We see sharp declines in rates that occurred in 2021 due to the pandemic across all grades. However, from 2022 to 2024, we see more steady decreases in rates across all grades. We see 34% of seniors using marijuana in their lifetime, 21% of 10th graders using marijuana in their lifetime, and then 10% of 8th graders using marijuana in their lifetime in the most recent survey. Next slide. According to the same survey, the Monitoring the Future survey, they asked about past month marijuana use among 8th, 10th, and 12th graders as well. And we see similar trends for past month marijuana use, with about a 2% decrease in rates for 10th and 12th grade youth in the US. When we're comparing the 2023 to 2024 survey data, we see decreases in past month use across the board. So 16% of seniors use marijuana in the past month. Just under 10% of 10th graders use marijuana in the past month, and then 4.3% of 8th graders used marijuana in the past month. Next slide. So the next we'll go over vaping information. And in 2016, the Florida Youth Substance Abuse Survey asked if youth have ever used an electronic cigarette and inquired about their current use of e-cigarettes. However, the survey added new questions for e-cigarettes in 2019. So the survey now asks respondents for lifetime and past month use for electronic cigarettes for nicotine and marijuana separately. So as we see here in this graph, according to the FYSAS, 12% of Florida youth reported using a electronic cigarette for nicotine in 2019. And that has since decreased to 6.6% reported vaping nicotine in 2024 for the past 30 days. For lifetime use, it's dropped from 23.5% to 16.2% for ever using an electronic cigarette for vaping nicotine during the same time period. Vaping nicotine is the second most used substance among Florida youth. So that's something to keep in mind as well. We can go to the next slide. The Monitoring the Future survey also asked about vaping nicotine among 8th, 10th, and 12th graders. And the highest rates of lifetime use across all grades were reported in 2020. So after 2021, rates for vaping nicotine for 8th graders has remained pretty stable, with 15.6% reporting lifetime use. And then for 10th and 12th graders, they reported using or vaping nicotine in their lifetime at 22% and 31% for lifetime use. And those two grades have seen more steady decreases rather than the 8th graders. Okay, we'll go to the next slide. Similar to the previous slide, we see past 30-day use of vaping nicotine shown here. The highest rates were seen in 2020. And then again, we see the decrease in 2021, a slight increase for 10th and 12th graders in 2022. And then we see a decrease among use, especially among 10th and 12th graders. For 8th graders, they remained at this stable rate of use. And they are reporting at 5.7% using vaping nicotine in the past 30 days, whereas 10th graders reported just under 10% and seniors reported 15% past 30-day use. Next slide. So just as the FYSAS data went over vaping nicotine, we can also look at vaping marijuana. So again, we have data from 2019 to 2024 in Florida for lifetime and past 30-day use. Rates are a lot lower for vaping marijuana versus vaping nicotine. Trend lines are pretty similar to vaping nicotine as we see continuously lower rates from the previous years. Rates are generally lower for vaping nicotine when we compare it to vaping or vaping marijuana when we compare it to vaping nicotine. And we see this with the most recent survey results, with only 5.5% of Florida youth reporting marijuana, vaping marijuana in the past 30 days. And then for lifetime use, vaping marijuana is at 11.7%. So again, these rates are lower than what we see for vaping nicotine. Next slide. For the Monitoring the Future survey for lifetime vaping marijuana among U.S. youth for 8th and 10th graders is shown here from 2017 to 2024. About half of the rates of lifetime use is seen across all 3 grades for the U.S. youth when comparing it to vaping nicotine. It's interesting to see that 10th and 12th grade youth were using at almost the same rate from 2017 to 2020. But since then, there's been a larger gap in rates. And then it's also interesting to see 8th graders continue to increase their use for vaping marijuana from 2021 to 2024 for lifetime use. Although 10th and 12th graders have seen a decrease since 2022, 8th graders have seen an increase since actually 2021. So this is something to make note of. Next slide. So the previous slide was lifetime use, and this slide is past 30-day use for vaping marijuana. Again, among 8th, 10th, and 12th graders across the U.S. So we see pretty similar rates from the previous slide. Again, 10th and 12th graders had pretty similar rates from 2017 to 2020. Then the rates start to separate more. However, seniors saw a 95% decrease in use from 2023 to 2024. So very sharp decrease among seniors in the most recent survey results. Rates for vaping marijuana among 8th graders has stayed pretty steadily since 2022, with rates in the most current survey at 3.9%. Overall, rates for vaping marijuana and vaping nicotine are not at the same levels as they were pre-pandemic, but they are much lower, at least for 10th and 12th graders. We'll go to the next slide. So the next substance we'll discuss is alcohol. And this data will go back to the National Survey on Drug Use. And past month alcohol use among adults in the US and Florida is shown here from 2015 to 2023. Alcohol is the most used substance among adults. Rates have generally decreased since 2015. In the latest survey, though, rates remain similar for the US adults, while Florida adults reduced rates by 1%. So in the most recent survey, 52.6% of Florida adults used alcohol in the past month, while 52.3% of US adults used alcohol in the past month. Next slide. So this slide goes over binge alcohol use among adults in the US and Florida. This is from 2015 to 2023, also from NSDUH data. Binge alcohol use among adults is fairly stable, especially since 2021. The US has had the same rate in the 2022 to 2023 survey as they did in the 2021 to 2022 survey at 23.5%. Florida adults shows a slight increase in binge alcohol use from 21.7% to 22.6% of adults in Florida been using or having binge alcohol use in the past month. And next slide. So with the NSDUH data, we can look at past month use among youth, among US and Florida youth. And the survey years have been stable from 2015 to 2020. However, the 2021 survey shows a lower prevalence rates. 2021 to 2022 data also is much lower than the previous survey years for past month use for both US and Florida youth. And then the most recent survey, the 2022 to 2023 survey, shows both Florida and US youth reporting alcohol use at 6.9%. We'll go to the next slide. According to the 2024 FYSAS, lifetime and past 30-day alcohol use among youth in Florida has seen a significant decrease. There's been a lot of there's been a significant increase in decreases for alcohol use among Florida youth, with almost half of the youth reporting using alcohol in their lifetime in 2010 to just over a quarter reporting alcohol use in their lifetime in 2024. And then almost a 50% decrease in change from 2010 to 2024 for lifetime use. And The same decline is seen for past 30-day use, and as you can see here, from 28% in 2010 to 10% in 2024 for past 30-day use. Next slide. According to the Monitoring the Future survey, lifetime alcohol use among 8th, 10th, and 12th graders is shown here from 2015 to 2024. Lifetime alcohol use has seen decreases since 2022 across all grades. Under 50% of seniors have used alcohol in their lifetime, making it the lowest prevalence since 2015. Additionally, the lowest number of prevalence rates among 10th graders is reported at 32% in 2024. And then for 8th graders, reported lifetime use is at 18.5%. Next slide. Past month, alcohol use among 8th, 10th, and 12th graders is shown here, again from the Monitoring the Future survey. 12th graders saw a 3% decrease in past month use in the most recent survey. 10th graders saw a 2% decrease, while 8th graders saw a 1% decrease in prevalence rates from 2023 to 2024. So overall, seniors have reported using alcohol in the past month at 21%, 10th graders at 11%, and then 8th graders at just under 5%. Next slide. We can also look at binge alcohol use among youth in the US and Florida. And the highest rates for Florida youth was reported in the 2017 to 2018 survey, and it has since then decreased to that in the 2022 to 2023 survey. US youth has stayed pretty steady at 3.6% for the past two survey years. So Florida has a slightly lower rate than US youth for binge alcohol use. We can go to the next slide. Similar patterns have occurred for binge drinking with declining prevalence rates among Florida youth since 2010, as shown here from the FYSAS data. So rates between 2018 remained pretty steady around 6.7%, but has most recently decreased from 2020 to 2024 to only 4.4% of Florida youth having binge alcohol use in the past, in the most recent survey year. We'll go to the next slide. So now we'll go over lifetime and past 30-day inhalant use among youth in Florida from the FYSAS data. So inhalants refer to various household products such as solvents and aerosol sprays that are only used through inhalation. And this is primarily used by children and youth. So only inhalant use among youth is reported in this report. So back to the survey, both lifetime and past month use of inhalants among Florida youth decreased from 2010 to 2016. And both lifetime and past month use has fluctuated slightly since 2016, but was at its lowest rate in 2024, with only 1.6% using inhalants in the past 30 days and 4.9% using inhalants in their lifetime. Next slide. Next, we'll look at lifetime and past 30-day club drug use among youth in Florida, according to the FYSAS. Club drugs earned its name as a group of substances commonly used by youth and young adults at parties and other entertainment venues such as nightclubs and concert venues. Club drugs are a mix of drugs from various classes such as GHB, ketamine, LSD, MDMA, and ecstasy as well. So all those are used under this umbrella term for club drug use. And so, according to this survey, club drug use among Florida youth has been decreasing since 2010 for both lifetime and past month use. While rates fluctuated slightly for both past month and lifetime use in 2020, the most recent survey, the 2024 FYSAS survey results show that club drug use among Florida youth has decreased to an all-time low since 2010, with 0.2% using club drugs in the past 30 days and 0.6% using club drugs in their lifetime. And then we'll go to the next slide, where we'll go over morbidity and mortality. And we can go to the next slide. And actually, this might be a good spot to take a break if I can bring it back to you, Robert.
Absolutely. Everyone, we will take a 5-minute break. It is currently 10:57, so we'll get started again at 11:02.
Okay, so to kind of go over what we previously had went over in the first hour, we went over a lot of prevalence data and self-reported data for the substances used in various different surveys for US and Florida youth and adults. And now we're going to switch over to mortality and morbidity um, results for Florida and US. And we'll first be going over hospital emergency department visit data. So as you can see here in this chart, the number of emergency department visits for all non-fatal drug overdoses in Florida is shown here from 2015 to 2023. Emergency department data can be important to serve as an early warning system to alert communities of changes in drug overdoses. This data usually rapidly is available within 24 to 48 hours of an ED visit and can tell a story of communities seeing overdose cases. And emergency department data is also interesting to see because it usually follows the same trend lines that we see with drug overdose deaths and the opioid epidemic in general. On this graph, we see the number of visits increasing from 2015 to 2017, with a staggering 41,000 emergency visits for non-fatal drug overdoses. There was a decrease in 2018, just like there was with in the death rate for overdoses. But as you can see, there's been an increase in non-fatal drug overdose visits from 2018 to 2021, with the highest ever reported number of ED visits at 50,803. The good news is, which I'm foreshadowing in the next couple of slides, We see that for the first time since 2018, a decrease in ED visits for non-fatal overdoses occurred in 2022. Although the number of ED visits reported decreased by just shy of 5,000 visits, 2022 has the second highest non-fatal drug overdose ED visits ever recorded. In 2023, though, a 32% decrease in the number of ED visits from 2022 to 2023 is shown on the graph, going from 45,000 ED visits to just over 31,000 emergency department visits. As you may notice, this is also one of the lowest number of emergency department visits recorded in the past 8 years. We can go to the next slide. So similar to the peaks and valleys from the previous slide, we see opioid-involved non-fatal overdose emergency department visits from 2015 to 2023 in this graph. Increases in emergency department visits for non-fatal opioid overdoses started in 2019 up until 2021. So we see the highest number of ED visits for opioid non-fatal overdoses in 2021, but then we see a decrease in emergency department visits starting in 2022, and then again in 2023, with just over 15,000 emergency department visits reported in 2023. We go to the next slide. And so, as I said in the previous slides, emergency department data is really good to look at because it usually mirrors the same trend lines as the overdose death rate as well. And so, as we see here, we have fatal drug overdose death rate in the U.S. and Florida from 2015 to 2023. So in 2015, Florida's fatal drug overdose death rate was lower than the US rate at 15.5 versus 16.3, but has since had a higher overdose death rate up until the most recent data in 2023. So as you follow through the years, the trend line for the US and Florida mirror each other, and the Florida rate in orange has been higher when compared to the US death rate. For the first time since 2018, the drug overdose death rate in Florida decreased from 37.5 in 2021 to 35.2 in 2022, which is a 2.8% decrease. The US death rate plateaued and actually increased by 0.2%. With the latest data, Florida and the US had a decrease in drug overdose death rates, and now Florida has a lower death rate than the US for the first time since 2015, with 30.8 versus 31.3 overdose death rate for Florida and the US. So this is really great news. Obviously, for 2 years in a row now, we're seeing decreases in the drug overdose death rate in the US and Florida. So this is really great news, as we all have been contributing to the widespread use of naloxone and the availability of medication-assisted treatment. Also, obviously, community education about the dangers of fentanyl and opioids in general. We can go to the next slide. So just as we see with drug overdose death rates, this slide goes over fatal overdose death rate, or fatal overdose deaths in Florida by numbers. we're seeing a decrease again in the past 2 years from 2021 to now. We're seeing decreases. Um, so as you can see here, there were just over 8,000 drug overdose deaths in 2021, and in 2022, the number of deaths decreased to 7,769. An additional decrease occurred in 2023 with 7,220 fatal drug overdose deaths in Florida. So again, this is great news for the overall Cape in Florida. We're seeing decreases in fatal drug overdose deaths. And then we can go to the next slide, and we'll discuss fatal opioid overdose deaths in Florida. So when we look at opioid overdose deaths specifically, we see a similar trend as we did in the previous slide. Fatal opioid overdose deaths also decreased from 6,442 deaths in 2021 to 6,157 deaths in 2022. Again, in 2023, we see a decrease with 5,476 opioid overdose deaths, making this almost a 15% decrease in deaths from 2021 to 2023 overall. So again, good news for fatal drug and also fatal opioid overdose deaths in Florida. We're seeing continuous decreases overall. We go to the next slide. And then the next slide. So now we'll look into more mortality data, and this comes from the Florida Medical Examiners Commission 2023 annual report. So the commissioner's report looks at specific substances throughout Florida, and this is where we'll get into the managing entities as well and look at the differences amongst them. So this chart shows 3 specific prescription opioids that the medical examiners showcase in their annual report, as these are the most abused prescription opioids. So we have oxycodone in blue, hydrocodone in orange, and then methadone in green. So the 3 prescription opioids, again shown here, per managing entity, and we can do a breakdown by managing entity by looking at the rate per population. That is shown here on the right side on the under the note. The rate per population is calculated by the number of occurrences for each managing entity divided by the managing entity population, and then just multiplying that by 100,000. So that's how we get the rate for each managing entity. And so overall, we can see that Broward Behavioral Health Coalition had 119 occurrences, which is the lowest amount, while Central Florida Behavioral Health Network had 562 occurrences, which was the highest. However, when we look at the rate per 100,000 population, we see that Central Florida Behavioral Health Network had the highest rate at 8.5, while the lowest rate for prescription opioids was in Thriving Mind South Florida region at 4.2. We go to the next slide. So Heroin was a defining drug of the second wave of the opioid epidemic, and the second wave is depicted in this graph with heroin-related deaths 2013 to 2023. In this 10-year time span, we see a bell curve with the highest number of heroin-related deaths reported in 2017. Florida has seen a continuous decrease in heroin-related deaths since 2019, and we know that the number of deaths from um, heroin has decreased since 2022, as we see here, or 2020, as we see here in the graph. There were 958 occurrences of heroin in 2020, and since then we've seen a decrease in heroin-related deaths with only 93 occurrences reported for all of 2023. We can go to the next slide. So among the managing entities, heroin-related deaths is shown here for 2023. The highest number of occurrences was found in the Central Florida Behavioral Health Network region with 27 occurrences. Due to population size and calculating for a rate per 100,000 population, Southeast Florida Behavioral Health Network had the highest death rate at 0.9, whereas Central Florida Cares Health System had the lowest number of occurrences with only four heroin-related deaths and a death rate of 0.1. We go to the next slide. So next we'll go over fentanyl and fentanyl analog related deaths among decedents in Florida from 2013 to 2023. So as we know, this was the third wave of the opioid epidemic, with illicit fentanyl and fentanyl analogs seeing a rise in most recent years. So we a rise starting in 2019 up until 2021. We had the highest rate of fentanyl and fentanyl analog related deaths with 9,218 occurrences in 2021. Since then, we've seen a decrease, and Florida has reported a 21% decrease in fentanyl and fentanyl analog related deaths from 2021 to 2022. In addition, there was another decrease in fentanyl related deaths for 2023 with 6,411 occurrences for that year. So again, this is great news, as we've seen from previous slides, the decrease since 2021, and we all know how much fentanyl and fentanyl analogs has increased dramatically throughout Florida, and so this is really good news that we're continuously seeing decreases for the substance. We'll go to the next slide. When we look at fentanyl and fentanyl analog related deaths among decedents for managing entities, we see that the highest number of occurrences were reported in the Central Florida Behavioral Health Network region with 1,931 occurrences for fentanyl and fentanyl analogs. The lowest number of occurrences was found in the Thriving Mind South Florida region with just 430 occurrences. And this region also had the smallest death rate at 15.0 per 100,000 population. And then the highest death rate among managing entities was found in the Southeast Florida region with a rate of 35.6 per 100,000 population. We'll go to the next slide. So the next substance we'll go over from the Florida Medical Examiner's data is cocaine-related deaths among decedents from 2013 to 2023. Cocaine-related deaths has seen a similar trend line as we did with fentanyl, reaching over 3,000 occurrences in 2017, and then reaching its highest peak so far in 2021 with just over 4,000 occurrences. There was a slight decrease in 2022 with just under 100 less cocaine-related deaths from the previous year. And then in 2023, there were 3,565 occurrences of cocaine-related deaths. Next slide. The total number of occurrences for cocaine-related deaths are shown distributed by managing entity here. And the highest total number of cocaine-related occurrences that occurred among the managing entities, the highest rate was in the Central Florida Behavioral Health Network region with 1,028 occurrences. The lowest number of occurrences was reported in the Northwest Florida Health Network region with 158 occurrences. Based on rate per 100,000 population, the highest cocaine-related death rate in Florida was in the Southeast Florida Behavioral Health Network region with 19.6, and the lowest cocaine-related death rate was in the Northwest Florida Health Network region with 9.6 rate per 100,000 population. Go to the next slide. So the next substance we'll discuss is methamphetamine-related deaths among decedents in Florida from 2013 to 2023. The graph here shows that each year from 2013 to 2021, methamphetamine-related deaths have increased in Florida. However, in 2022, the number of occurrences remained the same, and we see a slight decrease from 2,934 occurrences in 2021 to 2,918 in 2022. However, in 2023, we see a sharper decrease in methamphetamine-related deaths with 2,682 occurrences for that year. We can go to the next slide. The highest number of methamphetamine-related deaths was 1,030 occurrences in the Central Florida Behavioral Health Network region. The lowest number of occurrences were in the Broward Behavioral Health Coalition region with just 78 occurrences at the time of death. And then when we look at the rate per 100,000 population, the highest rate for methamphetamine-related deaths among managing entities was in the Northwest Florida Health Network region with 22.2 rate per 100,000 population. And then the region managed by Thriving Mind South Florida had the lowest methamphetamine-related death rate with 3.6 per 100,000 population. We can go to the next slide. So overall, substances reported in the 2024 FYSAS shows continuous decreases in prevalence rate among Florida youth. Marijuana use among youth and adults has increased nationally, but not among Florida youth, according to the 2024 FYSAS. Vaping nicotine and marijuana among youth remains steady, and the most recent FYSAS survey data shows overall decreases for Florida. However, vaping nicotine is still a top substance for youth nationally and also in Florida as well. We can go to the next slide. And then emergency department visits in 2023 decreased in Florida. And also the annual report from the medical examiner's data, we've also seen decreases in drug overdoses from 2022 to 2023, which is great news for Florida as well. And then we can go to the next slide. So these are the updated references and sources where I obtained the data, and I will pass it over to Robert. Thank you so much for listening to my presentation on Florida youth substance trends.
Thank you so much, Ben. I want to take a moment and see if anybody has any questions. I know there's a lot of data, a lot of trends reported. I do see a question here about the managing entities and a potential typo in the last slide. So those two managing entities are separate, and I'll look into that. But does anybody have any questions about the data that was shared? I'll give it just a moment. Seeing none come through, I'm going to go ahead and switch over to the conclusion. I do want to say that you have the slides available to you. The annual report should be published in the next week or two. So the full written report, which is a more expanded version of this summary, will be published and emailed out within the next week or two. Ben, there is a question in the chat that says, why weren't ninth graders reported? Is that just the general way the FYSAS works? The 8, 10s, and 12?
So for the Monitoring the Future survey, they only do 8th, 10th, and 12th. They just skip a year. That's just how they administer their survey data.
Got it. And then somebody else just asked, is county data ready to review?
What data are they referring to? Sorry,
I will let them respond
okay.
to that. Susan, if you would like to clarify specific county data from FYSAS, what is the response?
Oh, I think yes, 2024 data has county data available. That's correct. That's on the FYSAS website as well. They have county specific data for 2024.
Thank you. And then there is a question, were the cocaine deaths just from cocaine, or was the cocaine mixed with other opiates? Is that information available?
For the cocaine related deaths, those deaths are cocaine occurrences, so they could be mixed with other substances as well. So with the medical examiner data, they have what caused the death and what was present at the time of death. And so there are a number of other substances that could occur with those cocaine related deaths that you saw in the most recent slides.
Perfect. Looks like another question has come in. The slide on pain relievers, was it for OTC pain relievers only?
Let's. I'm trying to read the message. I believe those are prescription pain. It's prescription only. So those prescribed to you as a doctor and misused, those were uh, the misuse on that slide.
Perfect, thank you. Susan, I just saw your message about not being able to click the links in the PDF. Not sure why that's an issue, but if you want any of the resources, send me an email. I'll drop my email in the chat and I can make sure that you get those links. Ben, were there any prevention efforts or legal deterrence efforts that factored in the decreases? Do you have any insight on that?
I think the widespread use of naloxone availability has helped a lot with the prevention efforts, and just overall messaging and awareness of what's going on in our communities has helped as well. Um, there's been money being put into treatment as well. So really, from prevention all the way to treatment, there's been a lot of effort to help with this decrease.
Awesome, thank you. Any other questions? Seeing none, then I will turn it over to the conclusion. I want to thank you again, Ben, for your time today. We appreciate you and your insight into Florida substance use trends. We have included Ben's contact information on this slide. If you have any further questions, you can reach out to him. I've posted a few links in the chat. So there's a link to today's evaluation. Additionally, when I end the webinar here in just a moment, your web browser should populate a message that looks like what is on the screen here. It says the host or presenter would like WebEx meetings to open a website on your computer. If you click continue, you will automatically be redirected to the evaluation. I will also post the link again momentarily. You must sign into your FATA account to complete the evaluation. If you do not have an account with us, you can register for one at no cost. You may do so by clicking haven't registered yet underneath the sign-in menu. You must use the same email address you used when you registered for today's webinar when you set up your profile in FATA system. This is the only way for us to connect your attendance during today's webinar to your evaluation completion. For CEUs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. If you need to add or update your license number, you can do so by logging in and clicking edit on the professional information section of your profile. You will get a third opportunity to complete the evaluation via a follow-up email later today. As a reminder to everyone, the evaluation will close at the end of the day on Monday, June 30th, 2025. For assistance with account login, account registration, or evaluation completion, you can fill out a contact us form on the FATA website or email the training team at training@floridabha.org. As a reminder, we do not email statements of credit. Instead, after we verify your attendance and the completion of the evaluation, a statement of credit will be posted to the professional development section of your profile in your FATA account within 30 business days. You must have attended the entire webinar and completed the evaluation for a statement of credit. We are not permitted to provide partial credit or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access recording and PowerPoint for this webinar or previous webinars, you can visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. Thank you for participating in today's webinar. We'd like to thank Ben again for his time and the work that he's put into both the report and this presentation. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.